my name is Beth. I am a third-year PhD student funded by Versus Arthritis. Normally I'd be presenting this with Andrew, my patient partner, but as he can't be here today, I'm going to try and channel his perspective, some of his opinions, and I think most helpfully like his teacher aura. He's got one. We've written this presentation today, and I promise that everything that I say here is endorsed by Andrew. I haven't gone rogue. Over the next 7-ish minutes, I'll be giving a brief introduction to the way that he's involved in our project and the way that we currently work. But just for a little bit of background, I'm interested in a concept called patient activation, which is how able and willing somebody is to take responsibility for their health, as well as how likely it is that they will self-manage. As part of my PhD, I've conducted several different studies, and I'll be talking about one particular here today. Also important to note is that this is my PhD. I promise I've made all the decisions and I've done all the work. So when I talk about how wonderfully collaborative our relationship is, I promise that all of the actual work has been done by me, just in case there are any Viva examiners out there listening. So it's routine within the team that I work in that every project has at least one patient partner attached. Andrew is mine. In an unusual quirk, he was attached to my PhD before I was, which I think tells you something about how valuable he is to the process. He was very keen not to be a box ticked from the very beginning, and I'm glad to say was, happily surprised when it came along, and I have a really strong belief in collaborating and working together as well. And I think that how we've embraced our relationship between research and patient partner is one of the things that I'm most proud of in my research journey so far. We meet both formally and informally. He has an open invitation to all of my PhD supervisory team meetings and any other activities that are going on. But we also meet very often one-to-one in a less formal setting, generally with hot chocolate. It's some way convenient for Andrew. We found a lot of coffee shops around Bristol that fit our requirements. This time gives us the opportunity to not only talk about the fine details of the project and to discuss his opinions on things, but also looking at the wider picture and about where the project is going, what the consequences and the implementation might be. And it's really become a two-way process as time has gone on. When I started early on, I sent him brief lay summaries of some of the things that I was interested in to give him a sense of what was going on. And what's been really lovely is that through my PhD, the journal article sending now goes in both directions. And I think that Andrew is just as invested in this research outcome as I am. He's really embraced the role of critical friend and has the confidence, I think, to be honest with me, especially when I'm wandering off into academic curiosity and maybe not always in ways that are particularly useful to patients. And he'll tell you himself that he views himself as part of the research team, so feels like he should act like it and really has the courage to be honest and open and contribute really openly. I really appreciate that. It makes such a massive difference. And this is him telling you it himself. He very often challenges my perspective and points out assumptions that I make, or things that I consider might be useful, but perhaps not practically very helpful to patients. In that way, he very much grounds my research, gives it a sense of, I think, credibility that at least one patient thinks it'll be useful. Trust me, I'm in the middle of year 3, that's a really helpful perspective for me to have at the moment. So the very brief study that I'll be talking about his involvement in is an interview study about how people understand the concept of patient activation and what it looks like to them. It was a longitudinal study, so people came in and interviewed with me twice, a year apart, and I recruited from 2 sites. I think that's all you need to know about that. The little yellow jazzy things give you a sense of all of the points where Andrew played a part in the process, and I'm quite pleased that I think it might be everywhere. He was key to being a sounding board for me all the way through. Whether it was thinking about what the actual need for the study was there a point? I had read the literature, but it was my job to discuss it with him and to talk about what might be important, what kind of concepts I was interested in and what I wanted to capture. the kind of participants I might want to recruit, and what I might do with them when we got there, what the interview schedule would look like, how the longitudinal aspect of the project would work, and whether that was practical, what that might mean for patients, whether we could time it in a way that it could coincide with their annual clinic appointments to save them coming in twice. He reviewed the interview schedule, the list of questions and prompts for me, and did a pilot interview with me and gave me honest feedback, and reduced the length of my sentences substantially. He reviewed all of the materials prior to the ethics application, including the protocol, the outcome measures. He's been a real champion and is always willing to look at paperwork, and I'm so grateful for that. Following this, when I analysed the data, he sat down with me and watched me wax lyrical about my findings with more hot chocolate, and talked about how closely that rung true, what that meant, what that means for the wider project and for potential clinical implementation. Given that the findings of the first interview set in motion the plan for the second interview, that was extraordinarily helpful and really boosted my confidence to bring it back to my participants and say, this is what I found, what do you think? He's been really invaluable in terms of a source of guidance. And like I said earlier, it's given me more confidence and credibility, I think, in my work. I strongly believe in not doing anything about patients without them. And so working in self-management, I think it's all the more important that I put my money where my mouth is. A clear example of specifically how Andrew, as well as a person, has impacted my research is that he has a background as a teacher. And so the way that we talked about how he understands health-related information, how he decodes it and then thinks about how he applies it to his life, as well as how much he remembers and recalls from his appointments, I think really brought me on to the concept of health literacy and how people understand health-related information. It's something that I might have gotten to on my own, but almost certainly 18 months later. And I think that his input, his perspective, his openness was so extraordinarily helpful in bringing me to that point. And it's something that I think has really shaped my PhD in terms of being useful. His experiential voice and my academic one seem to come together to make a great team. And he's been very open about his personal experience and being a sounding board as somebody who attends rheumatology clinics. And this is particularly relevant when he talks about how much more of his condition he notices that he does in his self-management than he didn't do before. I try to make sure that I'm thoughtful about how much I ask and where and when and in what context. But always with this sensitive opt-out that you never have to say anything you don't want to. But he's been really open and really willing to that. And in some ways, his voice has been the one that I've paid attention to the most for my PhD. Maybe don't tell my other supervisors that. Because his understanding of what self-management looks like and what it means will be closest to my participants and the other patients that I hope to develop this research for. As I'm wrapping up, I think it's most important here to make sure that I give Andrew the last word, as it's been fantastic to tell you all about the benefits for me, but what does it mean for him? What Andrew will tell you is that working with Beth allows me to find positives in the way that my life has changed. Strangely, it enables me to see my condition in a more positive light. It's very easy when your life changes through ill health to focus on what you've lost. Career, social activities, changes in energy levels, changes in relationships. However, given the opportunity to act in a positive way, then it's possible to change your perspective. I can't think of a better advertisement for working with patients than that. Thank you very much.